All right. Hey, everybody. I'm Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance based in New York City. And this is day 2 of NYHD Life Audiologists at Home. And what we decided to do was take some time because we're not able to see patients, but we decided to spend some time with some of our clinicians. We're going to try to do this on a daily basis where we will answer some of the most common questions that we face on a day-to-day basis in our clinic with our patients. Today, I have with me one of my colleagues, and I'm going to bring her in right now. This is Dr. Ariella Naim. How are you?
Good. How are you?
Good. So you're living in New York City, so you're not too far from our office.
No.
It's unfortunate that we don't get a chance to see each other every day in the office, but we're going to do what we can do here. But I appreciate you spending the time today to answer some questions for us. So one thing that you are our specialist in our practice for is implantable hearing devices. So these are devices that are not necessarily kind of your run-of-the-mill hearing aids. These are things for some unique cases in many instances with patients that might not be able to benefit from our traditional hearing aids.
Right.
So today, what I figured I would do is ask you a specific question about one of those types of devices. So,
Okay.
you game?
I'm ready.
All right, here we go. So my question to you is, what is BAHA? And ultimately, once you tell us what that is, who's really a candidate for this specific type of technology?
So again, typically, like you mentioned, when we have patients who use like those traditional types of hearing aids who the sound is being picked up from the device that's either sitting behind the ear or in the ear, it's sending the signal from the outer, middle, and inner ear all the way up to the brain. There is actually a third type of device where what we call a bone-anchored hearing aid or BAHA, and it is a surgically implanted device that's sitting behind the ear. And it's sending the signal directly to the cochlea in the inner ear, and then from there it goes to the auditory nerve up to the brain. This type of device is really, really successful with patients who have what's called a conductive hearing loss or a mixed hearing loss, and even with patients that have what's called a single-sided deafness. Now, with conductive or mixed hearing loss patients, what's nice is that again, it's bypassing where the hearing loss is occurring in the outer or middle ear, which is what's called a conductive component.
Mm-hmm.
And again, stimulating the inner ear, directly. With patients with single-sided deafness, we have a normal hearing ear on one side, and then we have an ear with no usable hearing. And the way the BAHA works for them is, again, with the processor that's inserted in the bone behind the ear, we're vibrating the bones in the skull, and it's transmitting the sound to the normal hearing ear, allowing them to hear, and from there, auditory nerve up to the brain.
I guess the one question that I have for you is you said surgically implanted. Now, the
Mhm.
BAHA is not necessarily a new device, although there's newer versions of it. It's been around for decades at this point.
Right.
And we're not surgeons, and we work collaboratively with a surgeon to put this implant in, but what exactly is the implant?
So there is a titanium piece, or what we call an abutment, that's inserted into the bone. It's right here, but then there's an external processor right on the outside. Again, like you said, this device has been around for so long, but as the years have gone on, they've gotten more discreet. The technology has gotten so much smarter to the point where even now we're able to connect to iPhone devices or even accessories on the outside, like other accessories where just getting us a cleaner signal. But just to kind of go back to what you mentioned, while yes, we are working with the surgeon, we are not the surgeons. The most important thing to keep in mind that this is an outpatient procedure, typically doesn't take more than an hour, and things have been really successful in a sense that because we are stimulating the auditory nerve or the inner ear directly, patients report much more clear and natural quality of sound, and they've just been really, really happy with it.
Yeah, just one other point on the surgery from what I understand is that it's not that much different than a dental implant really. So it's yes, it is surgery and all surgery is serious no matter how you look at it, right?
Mhm.
But as far as surgeries go, this is not that much different than a dental implant itself. So there's the reality of doing a live video. No big deal.
I was gonna say, my Siri's picking it up.
That's all good. So what you're telling us is that there's certain candidates that are appropriate for BAHA. That happens to be people who cannot put a traditional hearing aid on because of things like conductive hearing loss, which oftentimes implies that there's some sort of drainage or maybe some problems with the middle ear bones that we can't fix. Or patients where they have a sudden hearing loss on one side and no usable hearing on that side, where
Right.
we're looking to cross the sound over from that poorer ear to the better ear so they can get some understanding of sound on that side. Sounds like a really
Exactly.
cool device.
Very cool. I'm all for
So
it.
awesome. So one thing that I just want to pop up there, which I didn't do throughout the course of this particular episode, is that we are trying to answer questions as we go through our audiologists at home, where we're forced to stay home because of what's going on in the world with coronavirus. So if you have questions, you can feel free to email us at info@newyorkhearingdoctors.com. The other part of the equation is if you go to our website, which is newyorkhearingdoctors.com right there, we are able to actually see some patients virtually through our HIPAA compliant video conferencing system, where we can actually have face-to-face conference with you, consultations on many things, including tinnitus, hearing loss. If you have just general questions about hearing or balance related issues, we're happy to help in any way possible while everybody else is kind of stuck at home. We just want to be of as much value as possible. So with that said, Dr. Naim, I know I will see you in the upcoming days. We're going to be doing more of these videos together. I appreciate your insights as the person in our practice who has the most insight into these implantable devices, which we'll talk more about as time goes forward. But I will see you soon.
Definitely. Stay safe.
You as well. Thank you. Talk soon.
Bye.